My name is Dr. Mohan Keshavamurthy. I'm Director of Urology, Uro-oncology, Robotic Surgery and Transplant Surgery at Fortis Hospitals, Bannerghatta Road, Bangalore. Today we are in the Robotic Surgery room in the OT complex on level 4 of Fortis Bannerghatta Road. We are working on a Da Vinci XI. My colleague Dr. Basavraj is doing a simple nephrectomy. Now the point of today's discussion is how has robotic surgery changed the perspective of urology and how has it benefited an individual patient. Now, with increasing diabetes in the Indian community, more patients have less kidney to work with as they age. And especially when they are affected by kidney cancer, it is essential that you spare as much of the kidney as possible. To put things in perspective, the liver is a female organ, the kidney is a male organ. What do I mean? If you abuse alcohol and only 10% of the liver is left and you give up alcohol, the liver does grow back to almost near normal over the next 12 months. However, the kidney cannot grow back. Each cell can only work more but can't create a new cell. So if the patient has a kidney cancer, it's essential to remove only the cancer and a millimeter to 2 millimeter margin of healthy tissue and leave as much of the kidney as possible. 1.5 kidneys is better than 1 kidney. And herein comes the ability of the robot to provide the kidney, to provide us the ability to leave as much kidney behind for the patient as possible. Combined with 3D lens ability is the precise marking using intraoperative ultrasound. We have a BK ultrasound, the world's best ultrasound, which can be dropped in through a laparoscopic port to precisely mark the margin between the healthy tissue and the cancerous tissue. Blood loss is minimal and cosmetic effect is wonderful. So we can return the patient to life within a few days after such a difficult surgery. In the prostate, especially the android pelvis of the male, which is a V, unlike a U in the female, there is very little space for cancer prostate surgery. The robot, which is with its arms, allows you to manipulate the prostate in a narrow confined area to provide not only a cancer cure benefit but also a continence benefit, which is the single biggest problem for men who undergo cancer prostate surgery. In other areas such as in incontinence surgery, sacral colpopexy for the woman, using the robot is a major benefit. Radical hysterectomies in those patients who have cancer of the cervix or the uterus is again a daycare procedure using the robot, virtually bloodless. In those patients who have a PUJ congenital obstruction, the robot has converted what was a very difficult laparoscopic or open surgery into a precise and simple surgery with a hospital stay less than a day. Overall, whether it be a cancerous pathology or a congenital problem or a reconstructive incontinence problem, the robot has brought solutions to both men and women in the Indian context, which was hitherto unavailable. Combined with reasonable costing ability at Fortis Hospitals, Bannerghatta Road, the robot does indeed seem to be a revolutionary weapon in our fight against disease in the Indian context.